I'm Dr. David Campbell, Wild Oak Wellness, and so a couple weeks ago we had a talk from Dr. Duke, and he was talking about his direct primary care, and he mentioned the idea that if you have direct primary care, you might want to think about getting a health share because direct primary care does a lot for you, but it doesn't cover specialists, it doesn't cover emergency, so you probably need something that does cover those things because you don't want to go bankrupt if you have an emergency or something like that. So I recently joined a health share called Impact. Troy here actually introduced me to it, and I was really glad to be able to join it because it cost me about half what an insurance plan would cost. The coverage is better, and my wife and I were transitioning out of our previous health plan, and we didn't have to wait till January. So that was really convenient for us. There's a lot of health shares out there. Some of you might already have a health share. You might want to try a different health share. That's all up to you. I like this one. I became a referral partner, so I can, help them get more customers. So that's full disclosure. But that's why I'm saying, you can check this one out. You can check any of them out. I think they have great coverage, competitive prices, but if you find a better one, that's up to you. So anyways, Alejandra is the person who's going to present. She's been with the company a lot longer than I have. I've just been with them a month or so. So anyways, without further ado, I'll start up the Zoom call.
Well, nice to meet everybody. Thank you for giving us a little bit of your precious time today. I'm all the way from Dallas, Texas, coming in live. How exciting is that? I love technology. So nice to meet you guys. Troy and David spoke very highly of all of you. I participated on BNI many years myself. So I understand all about networking groups and how powerful they are and how we love to support one another. So thank you so much for giving David and Troy the opportunity. I had the pleasure of partnering up with them on what we're going to show you today. And we're excited. We're excited because we have a disrupting service. Nothing new in the sense that I know we're bringing out to you health sharing today. Nothing new in the market. It's been 30 years in the making, but very new in technology. And that's what makes us so different. So let me share with you a couple of statistics on the healthcare industry to see how truly broken this industry is. So I'm going to share my screen. Let me know, maybe a thumbs up if it's showing right. Perfect, excellent. And I think healthcare is in a health insurance, particularly, is in a place right now in time where I'm yet to find a business owner or a self-employed person excited about the cost of healthcare. Also, I'd like to maybe point out a couple of good statistic points here for you. First one, that the average person here, it's actually paying about $450 a month. And that's in my books cheap for most people that I actually have encountered myself. And the average family is paying close to $1,800. And that is, with what they can get as far as insurance goes. And those statistics as from 2021, I know that everything has gone up this past year as well. And it's sad to say, but about 60% of the bankruptcies that happened in 2019 were because of medical expenses. So it's a sad world in the United States when it comes to health insurance. And so we can see the need for it. Another thing is, as of today, in the middle of open enrollment, 80% of the country is trying to lower their healthcare costs. So, I mean, every single person that I've asked that is self-employed or a business owner, hey, are you happy with how much you're paying? The answer is no, or I don't even have it because I can't afford it. But the sad part is that 5% of the population is actually responsible for 50% of the expenditure costs in healthcare. And so it's the healthy people that is overpaying for the ones that are not healthy. And that is why insurance is the way it is. And they have very deep pockets. And so when there is a problem and we find a solution for the problem, it usually works out. And we've seen it happen in many industries before. We've seen how technology was used to completely change the face of the movie industry. I mean, how many of you remember Blockbuster? I can still smell it. We were actually talking about this last night. with some of the women that I met for Christmas, and we were just talking about Blockbuster, and I was telling them I can still smell Blockbuster, right? The popcorn. I do went in, and you know, Netflix came in and utilized technology and completely disrupted the industry, and Airbnb and Uber did the same thing. And the best example I can give you for what we do is Uber. And so if you think what Uber did, Uber actually used technology, but also used the assets of the community. In their case, the cars, right? So they put the assets in the middle and they say, let's ride each other's cars. Brilliant concept. And let's utilize technology to communicate with one another. But you know, you don't decide which car comes get you. Uber has a technology that decides what car is closest to you. You do not tell the driver where you have to go. The technology does that. You do not pay the driver. The technology does that. And so at the beginning, I don't know about you, but I remember, you know, when Uber started thinking, oh my goodness, this is what mom told me never to do, not to hop on a stranger's car. But today, I don't know about you, I don't know how to call a cop. And so all I do is Uber or Lyft. So I think these industries came and changed completely the way that things were done. And we're doing the exact same thing in the healthcare industry with no exception. We're using technology, a patented technology that is just patented to impact health sharing, that allows us to work like insurance, in the sense that you'll get a card. I'm going to show you how you get the card. You present the card at the doctor. So what makes us so different from other shares that you'll see out there is the technology that we use. So once you have impact health sharing, you do not need any other insurance. This is all that we have. It works better and it feels better than insurance, because insurance is complicated. It's not transparent. They have deep pockets. And one thing that I will tell you about impact health sharing is a non-for-profit company. And the fact that it's non-for-profit is crucial, because it doesn't mean that they're here to make money. They cannot illegally make money. They're here to solve a problem that we have in America and completely disrupt an industry that needs disrupted. So I'm going to share a 5-minute video. It's going to do a great job at explaining impact to you. And then I'll come point out a couple other things, and then you can ask me any questions you have.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing began in churches. You were asked to contribute to help Bob and Sue with their ailment. People passed the hat and you contributed what you could to help your fellow member in need. Then, fast forward, you saw great things occurring in the Amish and Mennonite communities doing exactly the same thing. Then it got a little more formalized in the 80s with some religious-based organizations, and then the Affordable Care Act came along. That's really what propelled healthcare sharing to its modern-day growth. You remember, the individual mandate penalized you with a tax if you didn't have health insurance. But if you were a member of certain healthcare sharing organizations, you didn't have to pay that. Now we know the individual mandate has, of course, been reduced to zero. But in the meantime, healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why? We're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing, and certainly with Impact. You can stop overpaying, my friends. Here's an important statistic to understand why. Department of Health and Human Services says about 5% of the population account for nearly half of the healthcare spending that occurs in this country. Majority are healthy. They're overpaying, though, for the non-healthy. Insurance has become really no longer affordable. 80% of U.S. adults rate lowering their healthcare costs as their top concern. So why Impact? Well, we're rooted in the Love Thy Neighbor approach, which allows us to welcome all races, all religions, all colors, all creeds. We were the very first healthcare sharing entity to launch this patented technology platform that really provides 100% transparency. This had never been done before in healthcare sharing, certainly not in health insurance. We have member-owned accounts. That way the money stays in your account. We have no network. You get to see any doctor you want. Again, providing full transparency on how all the money moves is something we're really, really proud of. And Of course, you have no open enrollment restrictions. Membership begins the first of every month. You just got to finish that application by the last day of the previous month. We also have great pricing and programs for individuals, for families, for seniors, and for groups. And remember, friends, it's a comprehensive program for your health. So we have preventative services, maternity, accident, illness, and of course, injuries. You have access to telemedicine and an industry-leading prescription drug pricing program. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total U.S. GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the healthcare they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
My friends, what we are simply doing is leveraging your sense of community with technology to control the cost of healthcare. I hope you'll join us. Next, you'll be
So what I love about it is the benefit of sharing programs in general is, as you saw in the video, is that we can actually lower tremendously the monthly cost. Actually, we're lowering specifically with Impact anywhere between 30 to 70%. And of course, we're privatizing the healthcare instead of, things like, insurance that have deep pockets. We're bringing memberships instead of being customers of something. We're members of a community. So it's a voluntary agreement. There's no contracts between us. And of course, we can negotiate because of that cost for both medical and pharmacy, because both medical and pharmacies, and I did not know, and I don't know if you know this, but I did not know until I started getting involved with this, they overinflate the price of things so that they both can make money. When Impact comes and says, no, that is not the true cost of things, there is a negotiated rate. And I'm going to give you some examples here today, but just for actually showing you what really separates us from other share plans out there is two main things. One is most shares out there, and I say most, and probably I'm going to say about 98, 99% of them are some sort of religion affiliation. We don't have a religion affiliation. We use a come one, come all, and love thy neighbor approach, where we accept everybody coming in, and we're never going to ask you if you do have a religion affiliation or not. And the second thing, and to me even more important, is the way we manage the billing and how transparent we are because of our patented technology that even other shares had attempted to purchase, and Impact had kept it to Impact itself. And the reason why they have this patented technology is the reason why we are not in reimbursement basis. Most of the shares out there either are limited on what they can cover, or they're limited on the way that they can actually work in terms of deciding who pays for whose bills. All of that is done internally. I don't decide whose bills I pay for. Nobody decides who pays my bills. The technology does it all internally. I don't even know how they do it, but to me, it just feels like insurance. It does not work on a reimbursement based. Most shares out there work on reimbursement basis, which means you pay and then you get reimbursed. and not everybody has the ability to do that. So let's just compare some of the main differences. He brought them up in the video, but just as a matter of highlighting them to you, first is the cost. I'll tell you my own example. When I joined Impact a little bit over a year ago, I was using Blue Cross and Blue Shield for my family. We are both entrepreneurs, my husband and I, and so we were paying $2,800 for our healthcare. Now, I tell you, if you would have talked with me 7 years ago, I would have had no clue. 7 years ago, I was vice president for American Express. That's what I did all my life. I worked in banking, so I really never knew the high cost of healthcare. I think we're talking about those that are paying for their own healthcare off of the marketplace. But when I left corporate, my biggest sticker shock was healthcare, and I was paying $2,700 to Blue Cross and Blue Shield. When we actually moved our family to Impact, now we're paying $628 for the same family of four. To us was a $2,000 a month savings. Whether you talk to me about $2,000 a month savings, the neighbor did, or the Girl Scouts cookies left a pamphlet at my door, if you talk to me about $24,000 a year, that is a lifestyle change. I am going to take a look at it. So I always say that our healthcare cost actually was reduced in a manner that now we're sending our kids to the private school we always wanted to send them based on the savings that we got from Impact. The deductibles that are usually for a family member on traditional insurance, we have a deductible per household. We call that our PRA. That's called private responsibility amount. And that is just basically how much you're responsible for before the share kicks in. Now, of course, there are things that are not going to go against your deductible, like your preventative care doesn't go against your deductible. It's free every year, or your telemedicine, which is free as well. But say I have an accident like I did, I broke my foot at the beginning of the year, and my whole entire the responsibility for my household was $2,500, and that is for everybody. Also, while you have to choose from a specific network of physicians or facilities with insurance, with us, you are not stuck with any network. You can go to any doctor you want. As a matter of fact, we have a member right now being treated at the Mayo Clinic because that's where the doctors are specialized for what she has had. I broke my foot. It was broken for 10 months. I just had my first x-ray. Thank you, Jesus. About 2 weeks ago, my very first x-ray healed. And so I wanted to make sure that they were not missing something. So I wanted to see the best orthopedic surgeon for feet that I could find. And so I found the orthopedic surgeon that does both teams, the FC Dallas teams and the Cowboys. And I was able to go see him just based on the fact that I could, because I don't have a network. Our RX pricing is incredibly lowered. My mother-in-law needed a procedure, and she needed to take a blood thinner, and I think it was called Eloquest or something like that, and it was going to be $545 with her Medicare Part D, but because she's also an Impact member, she actually was able to pay about $100 for that. So she saved $400 on just her medication. And it's because, we use what's called wholesale pricing. Our cost shares and provider fees are very low as well. And I love our feature, the 24/7 free telemedicine that you can get. And if you know anybody that's from the countries of Mexico, Guatemala, or Canada, and they do not yet have a social security number, we can still help them with this. So there's a whole entire community there that we were able to help. So about what's covered, just as a matter of rebriefing again what was said to you on the video, you have access to all preventative care, mammograms, pap smears, your blood work, your annual checkups. All major medical events are covered. Mental health is covered. Chiropractic and physical therapy is covered. This was huge. You get up to 50 combined visits a year. And truthfully, I didn't get any with Blue Cross and Blue Shield, and I go to my chiropractor every single week. Your like I mentioned earlier, your prescriptions are discounted tremendously, and of course, the free telemedicine as well. Now, no network restrictions, like I mentioned, and another important thing is no open enrollment restrictions. So we can help enroll somebody all the way until the very last day of the month for the very first of the next month, year round, which is great. This is an example of our card. So you can see when you go to the doctor, this is the sample of the card that you would present. On the left-hand side, you see our provider's fees. You see that is on an office visit is $50. Of course, telemedicine is free. Urgent care specialists and outpatient services are $75. And that's what you pay as you get there. And for the ER is $150. My ER with Blue Cross was $400. So that is pretty good as compared to providers' fees that you have with traditional. And there is your EVI payer ID. and the PO box for them. And this is what the hospitals, the physicians utilize to actually help with billing. So to show you an example of who our targeted customers are, of course, are individuals and families who are fairly healthy. We do have a pre-existing condition that is 36 months back for those that are less than 65 years old. But if somebody has high blood pressure or high cholesterol, it doesn't count as a pre-existing for the purposes of any future vascular or cardiac events, which is great because majority of the pre-existings in America lay on those categories. And we can help everybody that doesn't have insurance right now at all, or maybe they are underinsured. Of course, those that are self-employed and independent contractors. We offer plans for single people. We started at $73. I did my pool guy yesterday, $73 a month. He's a young cat and it goes by age. And he was so happy because he didn't have anything. We can help seniors. We can come into what's called Medigap or your supplemental insurance for seniors, so long they have Medicare A and B. And no pre-existing conditions matter. So if you are over 65 and you have Medicare A and B, we can help you, and no pre-existing conditions are counted. Everything's covered. We can also help groups, so long they're under 49 employees. For those that are over 50 or more employees, there is a little bit of a side road that we have to take, but it's doable as well. And then families, of course, like mine, starting at $378 a month. And how we get a quote is simple. We're just going to need the date of birth of the oldest person in the household. It doesn't matter if you've had, like, say, for example, my nurse that does my IV drips. She had cancer 10 years ago. She's on remission. So that doesn't count as a pre-existing condition for her. But her insurance was charging her $1,300 a month just for her because she was considered high risk. Here, that doesn't matter. We go by age and number of people in the household and what type of deductible you want. And if there's more than 3 people in the household, you only pay for 3, but everybody's covered, which is great for big families or families of 4+ like me. We're covered 4 of us for the price of 3. But if you have 5 kids, 6 kids, 7 kids, you can have them all covered and everybody for the price of 3. So here's an example quote for the year 1999. As you can see, in this case, I quoted for 2 people. We have 4 deductible options: $2,500, $5,000, $7,500, and $10,000. So there are an increments of $2,500. Once that is done, you're only responsible for 10% of the bill, up to $5,000 for the whole household. That's what we call the co-share. You know that to be the copay. And on the right-hand side, you're going to see the standard rate. You're going to see that is this the lowest is $260. That's for a $10,000 deductible, or as much as $398, and that's for a $2,500 deductible. We asked one of our business partners that also sells health insurance to quote us in the open market for this family of 2 with Blue Cross and Blue Shield, and we came to $1,200. So you can see $398 versus $1,200, the type of savings that we can bring for people. And look at their deductibles. Their per person is $3,500 or $7,000 for the whole entire family. And then, of course, if they're in network, and then if they're out of network, that goes incredibly higher to up to $21,000 for both of them. So we're helping people with this service, and I gained tremendous confidence, unfortunately, with it when I broke my foot at the beginning of the year. This is an example quote for somebody that is over 65 years old. It goes completely different. The deductible goes as low as $1,000, and it's fixed. That's it. There is no copay or co-share after that. Is 0%, and the price is around $100. And I say around because I've seen it go from $96 for the ones that are just 65, and the ones that are a bit older, I've seen it going up to $119, $120. So it oscillates right around $100. We can also do quotes for business that are paying too much. We can do group offerings, and which a lot of small business owners don't even provide healthcare for their employees. As a matter of fact, as of today, 9 out of 10 small business owners do not, and it's a cost thing. But because they don't offer, people usually leave them looking for what? benefits. And so we can actually help them with, retention of their employees by offering a much cheaper solution. We're averaging about 40 to 50% savings as compared to the open market. There is no participants minimums. There's no contracts that they have to do either. And we can help them with the ACH withdrawals and customize their statements and put it on their payroll and set up the payroll. And we can give somebody a quote just by them providing us with a list of their employees and their date of births and how many members they have in the household. We can give a quote for that. And once they're in business with us, we'll continue the support. We'll add any new employees that they come in, or delete any employees that leave. So we actually do the whole entire experience for the business owners. And here's an example of a business owner that has been working with us through Impact.
I've been in the aerospace industry going on 40 years. We have 130 employees between two facilities, one here in Connecticut, one in Fort Worth, Texas. And we currently are offering Impact as an option to our standard insurance offering with Cigna. And we have 9 employees that have taken advantage of that so far. Others are very interested. And just with those 9 employees, we're saving $7,000 a month over what it would have cost us with Cigna. Not only that, but this past year, our renewal with Cigna was over $1 million. And we got a quote from Impact. And if all of our employees switch to Impact, that cost would be $360,000. So I don't know.
So I just wanted to point out to you how $7,000 for just 9 employees, but they would save over $300,000 if all of their employees switch to Impact. So the type of savings that we can give, and people ask, well, from a provider's side, from a doctor's perspective, what is Impact doing for the doctors that is better than what insurance is doing for them?
Hi everyone, this is Dr. Mara. We are very excited because we are now accepting Impact Health. And these are the few reasons why. Number one is the approval process is so simple. It's right on the spot versus other insurance companies. It takes about 6 months to even 9 months for us to get approved. Second, we get paid more with Impact Health Share compared to other insurance companies. So providers love it. And the third one is we get paid fast. Within 10 to 15 days, when we send our invoices, we get paid right away. So there is no reason for you not to talk to your.
So just want to point out to you that Impact is paying them faster within about 10 to 15 days. They're actually telling us that the average is about 20 days. And I've seen that as well. When I see my own bills being processed, it's about 20 days that they're getting paid. The providers, they get paid faster. Insurance takes months to pay them. They don't need a contract. And so it's pretty fantastic. And I just want to show you briefly, because I know we're running out of time, a couple of reworks that they've done with bills. This was a lab work that was done for one of our members. And if you can see there, the charged amount that the lab did was $2,400. And Impact said, no, this is not the right cost. We're going to adjust that down. And there you have it. It was $311 that ended up being that same lab work instead of this much. Now, proof for sharing for this particular person was $150, based on the fact that we get $150 towards labs every year, and their member responsibility was just $161 out of a $2,400 bill that would have been normally with insurance. Give you another one here. This was a hospital bill for one of our members. The hospital bill was $22,000. We're all used to see these hospital bills. Well, Impact comes in and says, nope, that's not how much this bill should cost. There's $21,000 extra that you're charging to inflate your pockets that we're not interested in you charging our member. The real cost of it was $1,100. In this case, was ineligible for sharing because he has not met yet his deductible. But what he would have had a hospital bill of $22,000, and who knows how much deductible if it was in network or out of network with traditional insurance, he only ended up paying $1,100. Same case right here. You see another one, $36,000 hospital bill that ended up in a $9,000 hospital bill based on the deductible. The share amount was $8,000 as how much Impact paid, and the the member was only responsible for $1,000. So there you have a $36,000 bill that our member and they're paying $1,000. I can testify that myself with my own bills. Happy to show anybody in my own back office and what impact has done for my family. But, wanted to point out to all of you one very last thing. What David, Troy, and we're business partners. We're all 1099s within a company. You have the ability to just be a customer for Impact and save yourself some money. You do not have to be a referral partner in order to become an Impact customer. But if you wanted to become a referral partner, just like David and Troy and myself are, and you say, you know what, I refer things all my life, good restaurants, good movies. But if you want to refer something to others that has worked for you, there is a referral partnership opportunity. We're not going to dive into that here today. That wasn't the purpose of this call here today, but I wanted to not only tell you that that is there, but also give you the ability to see what could happen if you were to become a referral partner and what are the type of residuals per month that you could get. We get a percentage of what the member is paying every single month. So if you had brought 25 members to the table, your residual per month for the life of that customer will be anywhere between $500 and $800. If you were to bring 50 of them, it would be close to $2,000. And if you brought 100 people, it would be about 4,000. Now we have a 98% retention rate on our customers. I always say either maybe somebody passed away or got unemployment that provided benefits completely and they just didn't need it anymore. But for the most part, people come in and stay. So our residuals are very, very long-term. So just wanted to point that out because I always think it's unfair for people not to know that they have that opportunity there if they're going to share it with other people. I always say nobody shared a great experience with healthcare with me until I actually saw this. So with that, this concludes my presentation. I know that David has a couple of sheets that he wanted to pass around. If you want more information about becoming a customer or a member, better say, we don't have customers for Impact. We're happy to follow up with an email. I have a great email that explains a lot of the things that you saw here. We'll give you the guidelines and a lot more information that we may not have gone over here today. If you just provide the emails to David, he'll give them to me and I'll send you a personal email from my account to actually tell you more about it. And if you wanted to see a little bit more, what does being a referral partner means, what would it intake, what would be my responsibility on my end, we are happy to meet on a Zoom for 30 minutes and walk you over that as well. So thank you for having me here today. And I don't know if you guys have time for questions or not, or if you want to do it in an individual manner as well, David, later on. I can make myself available for that.
Yeah, does anyone want to ask a question? Or it's a lot to digest, I'm sure. That's why I posted.
I'm happy to follow up with emails and then follow up individually.
So I have a question. Maybe I got pulled away, but when you mentioned a hospital bill that was $23,000 and then you guys were able to discount $21,000 of that, and so there was the difference. Is there a point where you show up at the hospital with your medical card and they go, oh, we don't accept that, we don't want to have to discount this bill 300%, right? And so does it become a limited care ability situation?
We're still paying the hospitals for what the cost and their profit is. What it is that they overinflate the bills in agreement with the insurance companies. The hospital will not turn you back because in the back there is an EDI payer ID. And I have not yet seen a hospital turn somebody back.
I can speak to this as well.
Yeah, go ahead.
So, like in my profession, this is pretty much, it's even worse with hospitals. People have to inflate their prices. So the reason they do that is because insurance companies will only pay you a small percentage of what you charge them. And so this is why the hospital bill comes back at $25,000, even though you're only there for 2 hours, is because they're expecting maybe 10% payment on that. And so a health share or an insurance company can easily get that down 90% to what it actually costs and what they actually need for the hospital to provide those services.
Even if it's a major situation, like somebody needs a hip replacement, or it is going to be a legitimate major expense.
And yeah, I mean, that's going to be more than $2,000, but there is still the price that they send to the insurance company. They never expect to get paid that price. And like when I was still working for insurance, that was part of the frustration. Is like you know, I was trying not to overinflate my price too much, and you get paid so little, you start to realize you have to just to get paid a living wage at all. And so that's what's going on with these hospital prices, which is why if you tell them, hey, I'm paying cash, you'll probably get it down at least 50%. They're just better negotiators than most of us, I think, because they know what they're doing.
And we have a third party renegotiating the bills to the true cost of the bills, and the hospitals are fine because that's how much they usually would expect based on the schedule to get paid. But that's how, you know, CEOs of major insurance companies makes millions of dollars a year. You know, that money is coming from somewhere, and that is where it's coming from. It's the insurance that ends up getting you for your deductible, whatever that was much higher, and that's how they're making their money. So it's a business, right? And insurance is a very profitable business, and we're a non-for-profit, so that is where the major discount comes in. There's no profit that needs to be kept, so we can put it at the very bare minimum to pay the hospital, because Impact has to make zero money from it because it's a non-for-profit company.
I have a question.
I didn't know it was that way either. If you're shocked, so was I. Trust me.
You have an injury. Can you hear me?
Yeah, I can hear you.
If you have an injury and you choose to go to a functional or integrative medicine doctor versus a traditional medical doctor, does Impact cover that?
That is a great question. I see a functional doctor. So long when so most functional doctors do not take insurance of any kind, at least not where I live here in Dallas. And I go to one. And what a functional doctor is, and David, it's your world, so correct me if I'm wrong, is a doctor that has both, right? That uses traditional medicine, but then they use alternative, right? So long when they give you the bill is itemized, and they have a legitimate code for it, you will get reimbursed. So that's how I do it. I actually do see a functional doctor. I do for, you know, I'm getting into my perimenopausal years. So I do see a functional doctor for that. And he coded the report to his bill to where, you know, there was the necessity for me to get this HRT done. And so we sent that in, and I got my reimbursement minus my deductible, but no problem. Now, if you see a holistic doctor that is only holistic doctor, and there's not an MD there or a medical professional there, it doesn't have to be an MD, but it has to be somebody, I don't know the terminology of it, David, help me out here, but it has to be somebody that's either doctor or physician assistant.
Yeah, I read the guidelines because I was curious about this. Like, it doesn't cover acupuncture, but that's because us as acupuncturists are not covered by Medicare as medical providers. So chiropractors are actually covered because they've gotten themselves onto that federal bill. But pretty much anyone you would see in a hospital, so whether it's a physician's assistant, a nurse practitioner, MD, they're all covered because they're included in the act that defines providers for Medicare. Acupuncturists may be in there soon. We actually have a bill in Congress that's pushing for us to get added to that. So we could end up being covered over the next couple of years if we get on that federal, because you have to be a federally recognized medical provider. So, which is most medical providers. Acupuncturists were recognized in 48 states, but unfortunately Congress doesn't really care about us that much, but we do have a bill before them, so hopefully it'll move soon.
Yep, that answers. So long they're, you know, federally, you know, recognized as a medical provider, then you can actually submit the bill and you will get reimbursed. And it has to be a code to it, a reason for you to have visited them.
Say about coding, all medical care has to be coded. Like, you can't, if you're not coding, if someone's not coding what they did, that's illegal basically. Like, they're not practicing medicine correctly. So you have to code the diagnoses and the treatments. So there's two separate coding systems, but they all, so that's normal. Like, I provide super bills for people who have insurance coverage so they can get reimbursed, and it's coded with diagnoses and treatments.
Any questions? So, with Impact being a nonprofit at its core, but you offering commission structure, just in our world of networking, we run into so many water pyramid type kind of things, right? And so you build up this pyramid and then the pyramid kind of collapses, right? And I know David, and I trust David, and I trust his judgment. So if he's involved with it, I would more trust his character behind that. But I always am a little bit leery of somebody saying we're a nonprofit, but yet we're going to pay you to get members to sign up with us, right? So is that something you've dealt with at all?
So let me bring that to you. So we are part of another company that is not Impact, that is the one that's paying us. And this company that's called ACN, and we can talk about separately from it, is a 30-year-old company that has done direct selling for services and has major contracts with other providers that are much bigger, just like DirecTV or Vivint Home Security System or Dish Network. So they're known for bringing customers and building distribution and bringing customers from a direct sales perspective. And the reason why we are better in pricing for all the services is because we are the advertisement channel. So the money that is set aside for programs and marketing is, instead of utilizing Impact saying, you know what, we out of our members, and it's all transparent because it's a non-for-profit, so they have to be transparent. So they will tell you, okay, out of what all the members are paying, this much is going for sharing purposes. This much is going for admin purposes, meaning their own employees that have to make this machine function. And this much money is going for program services, marketing, etc. Out of that money that is going for program services, instead of saying, you know what, we're going to pay for billboard, we're going to pay for, a TV advertisement, they decided to have us be the only distribution channel. So this company that is a direct selling company has a marketing agreement, an exclusive marketing agreement with Impact to bring them what they want most, customers. And so they're utilizing us as their sole entire marketing channel. And the reason why they chose a direct selling company to do so is because the wife of the founder, of the CEO and founder, creator of the technology for Impact, which is a gentleman you saw on the video, his wife's father owned a direct selling company for many decades. And so he understood how powerful the model of direct sales is, because the mouth to mouth, though I used it and it worked for me, works a lot better than a TV advertisement. But that answers your question.
I think somebody else is going to jump in.
Yeah, who's heard of Mutual of Omaha? Anybody heard of Mutual of Omaha, right? Insurance company. So life insurance companies, there are mutual companies, there are stock companies. So a mutual life insurance company works on a similar concept as a nonprofit or organization. So at the end of the year, when a mutual life insurance company has profit, they have more money that came in than went out, they're not allowed to keep all that money. They can put some aside in reserves, and then some is distributed back to the policyholders. They call it a dividend. So that's a similar concept here, is that, so I have a life insurance license, I write a policy with Mutual of Omaha, they pay me a commission, even though it's a mutual company. So it's a similar concept here where Impact is a nonprofit organization, yet people who are spreading the word are being rewarded financially for helping bring in customers. So similar concept there.
And also that dividend concept, I was told by another person who I spoke with that he ended up getting 2 of his monthly share costs, like a premium returned to him last year, because they had too much money in the company that they hadn't spent. So that's when it's a nonprofit, they can't hold on to that money, so they actually just give it back to you. So that was another thing that made me feel like, oh, this is a pretty cool company that if they don't spend your money, they just give it back. And the main reason I became a referral partner is actually because you can refer yourself and you get a percentage of your own share back. So I was like, oh, might as well save a little extra.
Well, so we're off the beaten path, but is there a minimum to becoming a referral partner? Like you have to have 25 people in order to go into that
No,
slot?
there's no minimum as far as I understand it. You just pay a one-time fee of $300 to get started.
Okay.
So, but then, you know, you're part of it, so.
You have 3 customers minimum. You have to have 3 customer minimum to start making money.
There you go. You have to have 3 customers. Okay. Got it. Awesome. Thank you so much for all your time and your presentation.
Absolutely.
You did a great job.
Thank you. Thank you. I love what I do. Look, I've never could stand behind something. I've been in this direct sell company selling other services for 10 years now. It retired me from corporate. So I always say, look, if I did it, anybody can do it from that end. I knew that I could never change anybody's lives just from a customer standpoint. Yes, I could save you $50 on your cell phone service, maybe $100 on your electricity bill, but can I really change your life with that? I cannot. But I tell you today that we're bringing back to families at $500, $1,000, $2,000 a month. That's a lifestyle change for people. America needs this disruptor. We are in need. Middle America needs all the help they can get in this recession to save money. And I can 100% stand behind it today more than ever. When we started selling Impact, and I'll wrap up with this, a year ago, I was a little afraid, I'm not going to lie, because I thought $2,000 savings a month, that sounds crazy. And for whatever reason, you know, when you save that type of money, you think maybe what you have is not as good as what you used to have. And it's that fear. And then, you know, the good Lord put me to the test because I broke my foot at the beginning of the year. And then for some medical oddity that nobody could understand, I had what's going on union and my foot was not wanting to go back together. So I needed a bone growth stimulator. I needed, which is a $5,000 machine that Impact got for me. I needed to see different opinions. I needed bone density scans. I needed MRIs. And I've used Impact in such a high level that my confidence for Impact went up the roof. And that's when I told my husband, I'm 300% in. I'm going to tell America about this. And that's what we're looking for. In my mind is when I find a referral partner is not only a source of residual income for you, it's standing behind a movement, standing behind something that most people don't have because they don't know they can. So, thank you for your time. I appreciate you guys. I love that you guys are there together. I'm a little jealous. I'm not going to lie. I love networking groups.
Thank you.
All right.
Bye,
Bye-bye.
guys.
Bye.
Thank you. Dave, one question I had was for those of us that were at the luncheon with Dr. Duke, and when I talked to Nels yesterday, when Dr. Duke presented, he presented his local care, but then he also presented a critical care option and a list of places. So
those were health shares.
Those were health shares, okay.
Yeah.
So is this critical care, or is this an alternative to what Dr. Duke was offering?
Well, it's whatever you, so what Dr. Duke offers is primary care, which is like the doctor you go get your physical from, or if you take a medication, the one you might get, you know, your new prescription re-upped from, or, you know, the person you see, primary meaning the first person you go to for your health care.
So is this not primary care then? Like, can I not
So this helps cover primary care,
okay.
But what his point was, is you need something for emergencies. Right? So most health shares are going to have something similar where they're going to at least partially cover your primary care. But what he's saying is what he does is not normal primary care because he's not just doing your physical. He wants to do a full workup and try to optimize like every vitamin and nutrient, make sure you don't have any toxic problems going on. If you do, he wants to get rid of those. So it's not normal primary care. So what he does, he charges a monthly fee. I think it's around $200-something a month. But he says because he can't offer you, he's not an emergency room, he's not a specialist in, you know, cancer or something like that. You know, he might help you avoid getting cancer, but say, you know, you just started with him and you find out you have cancer, you need an oncologist, he's not an oncologist. So with your health share, you can go to whatever doctor you want, whatever oncologist, if that's who you want to see, that you want, and it covers it based on the sharing.
So if I wanted a primary care doctor, that relationship, I would have him and I would have this. I'd have both of them, right?
That's what he recommended, right? So he was recommending, because what he does is so above and beyond. His membership, I was surprised how little he charges for what he's saying he provides.
I think it was $250 for an entire family,
Yeah.
and that was if you had 10 kids. It didn't matter, you know.
Yeah.
So
it's impressive that he's able to do that. Spends, you know, his doctors and himself, they spend more time with you. They do way more labs, and it sounds, I'm not sure he has an in-house lab, but it sounded like he might, which is probably what brings that cost down, because these you saw what they're charging for labs 24.
They send them out. But
okay.
Even if you're a member, because we're members.
Yeah.
And they charge for labs, but there's like a discount for members.
Yeah.
But you know, your doctor visits.
Sure.
Like.
Right. And so your share wouldn't cover the direct primary care, but you can think of it as like you could get the share with, say, you know, the higher deductible, because you're not expecting to use it. That keeps your monthly price down, and then you can have the direct primary care so that.
So there's some adjustability
Yeah.
there. Yeah, that's kind of what I was trying to figure out.
So that's what he was recommending, is that you get a low price on your health share, because I mean you can see how much less it is than insurance, of course, and then he can do your primary care. They do offer, I think what's cool is they offer free telemedicine. So for like, if you just have a question for a doctor and you're like, I don't know who to ask, you can just turn it on and ask them, which is kind of cool. Yeah, because someone I talked to recently who's actually been to this group, he told me he ended up having to do a telemedicine visit for his son, and it was $250 just for the 5-minute telemedicine visit, just because they weren't sure what to do. So
efficient.
Yeah.
Awesome. All right. Well, thank you, everybody. Thanks. I think we nailed it. Right?
Good job.
Thank you.